Good day, everyone. I'm Ivan, the moderator for this webinar. I welcome everyone to today's webinar, Preventing and Responding to Active Shooter Situations in Healthcare. I would now like to introduce our presenter for today, Mike Cummings. Mike Cummings, CPP, is a 50-year veteran of private security with the last 37 in the healthcare sector. Mike has been a certified security professional, board certified in security management since 1987. He obtained his BA from Marquette University and an MA in Business and Organizational Security Management from Webster University. I would now like to hand over to the floor to the speaker. Over to you, Mike.
Thank you very much, Evan. Good afternoon or good morning to the participants, depending on where you're calling in from. It's a real pleasure to be here today on behalf of the conference panel and to make this presentation on a topic that's near and dear to my heart. So let's get started with an overview. There continues to be a rising frequency in both severity and randomness of active shooter situations across our country. Two specific types, generally speaking, and they are targeted and non-targeted. And by targeted, it oftentimes starts out as a target where there's a specific person or persons that is the target of that active shooter. But sometimes it gets into non-targeted when other innocents that weren't even going to be a target happen to get in the way. And we'll talk a little bit about how to plan for both of those. What are the outliers in healthcare? So now I'm going to launch into some foundational elements that you should have in your program. Some of the general considerations that you'll have to deal with will be the size. So the size and the scope of your program will need to be considered as you develop all of your individual elements. Some of the foundational elements, and this is a really key one. So then identifying the team, I've thrown up some specific departments. Communications, both internal and external, is extremely important. So let's talk about education and training. All staff will need to be well versed in both education and training. You should do your education training from the general to the specific. An important part of it is considering what frequency that you need to do it for your staff. It should have a competency checklist to go with it. Run, Hide, Fight has some great advantages. The next element that I'll talk about is real-time campus notification. It needs to have both physical and procedure elements. And in that, you want to consider the language of the announcement. But I'm a big proponent of using plain language in an emergency situation. Ensure that it's universal. Notification should include testing elements. So other response protocols. Let's get into some response protocols. Again, training. I'm going to go through this again quickly. That should be more in-depth and task-focused than the overall education. It should have increased frequency. Again, it should be formal and informal. It should have competency elements for things that people really have to do. It should have documentation. So in the worst case scenario, you can document that, and it should be redundant, as I said, with other formal and informal. The training should keep in mind what your appropriate staffing level is. So let's talk about drills and exercises, and I use those kind of interchangeably. The communications now. We have crisis communications, and we have during communications. Just to skip down a little bit, it'll also be first responder notification. Want to make sure you have accounted for where's our family notification and reunification. So again, the phases of recovery and to be accounted for after the fact. The immediate recovery is who needs medical assistance. Then there's a short-term recovery, monitoring personnel and doing feedback and talk open discussion groups. In long-term recovery, part of that team should be involved in it, even that we already talked about. So I know I've given you a lot of information here so far. So communication, responsibility, saying what you're going to do, what you're going to say. One hospital I was at, providers of a mass notification system. Well, thank you very much. I hope I've given you a really good roadmap of things based not only on the two reference materials that are still here on the screen. ASI International Active Assailant is a national and an ANSI. It's an ANSI and an ISO standard. It's vetted at the highest levels. The IAHSS Active Shooter is part of ponderance of guidelines that we at IHSS, I served on that IHSS Guidelines Council for 9 years and was responsible with a team to draft these guidelines. And so they are reviewed widely every 2 years, 2 to 3 years, to make sure they're current, or they could be changed if something major is known to be out of date in between. International Workplace Violence Prevention and Intervention Response Standard is part of the overall workplace violence. So the other one that is really huge that you need to be aware of, and it's part of that overall workplace violence prevention guide standard I mentioned. All of these things are incorporated more broadly in this workplace violence and inactive assailant standard. I would just like to thank the participants for your attendance and your interest in this. I think it's a very important topic, and hopefully you have some tools now to go back and try to make your organization safer. Thank you very much.
Thank you. Thank you, Mike. That concludes the session for today. Thank you everyone for participating, and you may disconnect now. You have a great day ahead. Bye-bye.
Bye-bye.